I can't wait to talk about influencing patients, a three-part series about the art and science of inspiring the yes. Not only inspiring the yes, but maintaining the yes all the way to completion of ideal treatment. Now, before we get very far into the weeds on the influencing cycle and the verbal skills required itself, let's just come up with some basic principles. First and foremost, patients make decisions about dentistry from the same values on which they make other life decisions, on emotion, which is the 90-10 rule. I mean, think about it. People buy on emotion and stay bought on logic, which means there needs to be an emotional connection to what it is that you want them to do in order for them to initially say yes and then reinforce it with all the logical reasons why. And that can get lost, whether we're talking about existing patients or new patients. Now, there is an important step to take, whether it's a periodic exam or a new patient experience. Your job, first and foremost, is to observe clinical conditions through guided co-discovery, and then make the causal connections between what you see, and here it goes, how the patient feels. And this is vital. So how are we going to do this? Patients buy not because they understand, but because they feel understood. And it is our job to get to that understanding. Now, here's an interesting point. Let's talk about the new patients for a second. 99.9% of patients who come to your practice are going to come in initially with what I call level 0 needs. And level 0 needs is kind of avoidance language. It's like going to the principal's office, which means they're going to approach you with avoidance language, kind of like saying, of course I do all my homework, is the same thing as saying, of course I floss all the time, because they're going to say what they think you want to hear. And that's usually that first step in the getting to know you engaged patient relationship campaign. The next level is what I call level 1, and that's surface problems, difficulties, minor dissatisfactions. It would sound something like, do you think you might be able to fix my crooked teeth? Right? And that's a step forward, because now we're engaging in the patient on something that is individual to them. Now, the most important thing that is essential for long-term engagement and commitment is to drive those level 1 needs to level 2 needs, which are those conscious or subconscious wants, desires, deeper needs and understanding. Now, here's the interesting thing. It would sound something like, not just, can you fix my 2 crooked teeth? The second level is, because I don't want to be embarrassed anymore. Now, the interesting thing is people don't normally identify their level 2 needs at once. It might not be awareness for them, and it's certainly not safe enough for them to share yet. What's even more interesting is that many dentists, treatment coordinators, hygienists only get to level 1. And that's where they stay, and understand that level 1 is going to give you possibly a compliant patient that says yes, but when any blockers arise, are going to ultimately say no. We want the committed patient that wants to do what you want them to do. So this series is going to cover a cycle of language of influence. And the whole goal of the cycle is to follow it to the ultimate result of getting that relationship through mutual agreement. And it is a step-by-step process. It almost always starts with asking questions to determine wants versus needs. You got to ask the question to get to level 1 and level 2. Now, if you're going to ask the question, you better active listen. You better be able to hear it. And if you're lucky enough, you get the gift of determining their motivators, what inspires them to move forward, and their concerns, what would cause them to backpedal on a decision. Now, once you have that gift, you can start the language of influence, starting with a benefit statement, which then follows a feature statement that supports that benefit, As we're beginning to drive towards the yes, we're going to ask a tie down, test close, and be ready and willing and able to respond to any objections. And that, my friends, is the language of influence. And we're going to take this one step at a time. The key skills that we're going to cover are the open-ended questions, active listening, and the gift that keeps on giving, discovering those motivators and concerns. So let's start with the open-ended questions and the vital importance of motivation. Again, I want to remind you that people buy based on emotion and then justify with logic. So your job is to tap into the why behind that buy. So let's start. First and foremost, let's look at some of the motivators and concerns. Classically, when a new patient or an existing patient is motivated to want the treatment that you are presenting, it's going to be aesthetics. They want to look better or increase self-confidence. Function. They want to eat, speak normally. They want quality of life. Health. Fear. Believe it or not, motivation can be fear. I want to avoid the possibility of any future problems. Practicality, like if I do this now, is this going to help me in the future? Guilt, the gift that keeps on giving. I don't want to feel guilty or ashamed by refusing treatment because my spouse is going to kill me. Peer pressure, which is outside the spouse. I'm appeasing someone and I'm supposed to be doing this. Status, I want to feel better as compared to other people. And honestly, pain can be a motivator as well. These are the reasons that a patient moves forward. Now, there are also concerns, and what you're going to notice is many of the things that can motivate can also block. Time, pain, denial. This isn't a problem until it hurts. Money, embarrassment, phobic, resignation, and a benefits mindset, which we're going to get into in just a little bit. So, how are you going to get those motivators, and how are you going to recognize the concerns? This is the fine art of open-ended questions. So let's talk about what open-ended questioning looks like. Garden variety questioning is closed questions that can be answered with a yes, no, maybe, or a grunt. Example of a closed-ended question is, do you have any questions for me as your clinician? No. End of story. An open-ended question forces more communication. Forces is a violent term, but it opens the door to more communication. So instead of, do you have any questions for me? What questions do you have for me? At least prompts, I'm not sure I have any, and that means that you're getting to know the patient. So that's a really important component of open-ended questioning. Now, if you want to make it even more individualized, we want you to use you or yours in your questions. Tell me about your experiences. What is your idea of ideal health? When you're using you or yours, we can't generalize. We're going to know that we're talking to the patient, and that creates a partnership. Now, the truth of the matter is if people buy on emotion, we want to get to the feelings and emotions, which creates the connection. So this is going to be, how do you feel about keeping your teeth for a lifetime? And, of course, we want you to stay in the question, which means we're going to continue to drive deeper to get to those level 2 needs. Why? What? How? Tell me more. And when you're willing to do this, you're going to get the gift of engagement, discovery, and ultimately a relationship. So let me give you some samples of open-ended questions that can be used in the 3 to 5 minutes before you start a clinical evaluation, either with new patients or existing patients. What are your most pressing concerns about your dental health, overall health, yada, 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 which could also then be followed by, and why, or tell me more. Number 2 is on a scale of 1 to 10, how satisfied are you with your smile, followed by why, or tell me more. Or number 3, how do you feel about your prior dental experiences, always followed by why, or tell me more. Right? Now, here comes an insurance mindset clarification question. Do you dare to ask? And my suggestion is yes, because I want to nip benefits being an obstacle to the yes. So what if it was simply a desire to know? So it might be, I see that you have some dental benefits, Mrs. Jones. What role do you see your benefits playing in your decisions about your care? What are your feelings about how benefits play into the decisions you make about your health and well-being? Now, all you have to do is then hear that it says doesn't really matter, it's nice to utilize, or I'm not doing a darn thing without it, and you're just going to be curious. I'm going to make a note of that. Thank you for sharing with me. So this becomes a very, very important skill right at the beginning of your relationship. Now, don't even bother asking the question if you're adding chart notes, fiddling with your computer, or doing anything else but being wide open and ready to active listen the response. Now, by active listening, there's some incredible benefits. You're going to identify and support the patient's feelings and perceptions without necessarily agreeing with them, including that benefits question. Encourage the patient to clarify their needs and wants. Demonstrate to the patient that you got it, that you want to understand them, that you want a two-way relationship, and you're going to gain mutual discovery on core issues and concerns, driving all the way to level 2. You're also possibly going to reduce the negative emotions that can get in the way of treatment acceptance, and very often do. So there is a formula. There is a way to active listen versus garden variety listening. There's a way to mirror and feed back. So the formula starts with what's called a lead-in, and that signals that you're focusing on the other person. It's going to sound something like, sounds like what I hear you saying, correct me if I'm wrong, so you're. It's basically turning what was just said back to the patient to verify, plus emotion. This is where you have to be a little bit of a behavioral observer, because now you're feeding back the emotion that was perceived through the words, how the patient feels about the situation. Sounds like you're excited, you're concerned, you're upset, you're skittish. Whatever it is, what you're observing is what you're feeding back. It doesn't even have to be the right emotion, because then the patient gets to say, well, not really, this is how I'm feeling. Plus content, whatever the patient was talking about. Sounds like you're concerned about the cost of treatment. Right? Sounds like you want to keep your teeth for a lifetime. That's the content, please. And you ready? The most important part of the formula is the pause. I call this jokingly the shut up of your face. Right? Stop talking, because the whole idea of active listening is it's going to alert the patient that you want to hear more. We're fishing for the motivators and concerns. So here's some examples. Sounds like you're committed to keeping your teeth for a lifetime. Pause. I'm sensing you feel concerned about the cost of maintaining ideal oral health. Pause. I'm hearing that you're not happy with your smile. Pause. Being open. Now, because I want you to be open, let's have a word about body language, right? You need to lean in. You need to be open. No crossed arms, no fiddling, no looking away. Eye contact is essential, especially since the whole office at this point is masked up. This becomes even more important. And if you are committing to active listening, please, no distractions. Really, really important. Because the single most important need of a patient is for assurance. And you leaning into what they say makes them feel important. Now, that's our first run. We have learned open-ended questions. We're going to active listen, and we're going to get the gift of motivators and concerns. Now, none of this is easy. It's easy to listen to. It takes a lifetime to master. I would say it's probably similar to learning Latin. So how are we going to master the influencing cycle? I want you to commit to this throughout this series. First and foremost, the best way to actually practice to mastery is choosing an influencing skill of the week. The good news is you only have 2 of them right now, open-ended questions and active listening. For the entire team, retrain them on the purpose and intent. Practice, 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 right? And make sure that you are allowing for staff integration. practice role play at meetings, but also make sure that you are then targeting patients to actually expand your verbal skill muscles on, because it's also really important to see success, build momentum. So remember, what gets acknowledged gets repeated. And be kind to yourself, because this isn't natural and intuitive. We think it is, but it's not. And so it takes patience, effort, acknowledgement, and appreciation to make this happen. So what's going to be next up in our influencing skills that support co-discovery? Benefit plus procedure statement, feature statements, tie downs, and test closes. Use these well. Watch the difference. Your patients will appreciate it.